if they have a negative idea about
Mm.
themselves, or they're really dealing with anxiety. If that sets in over a long period of time, I'm sure it's very hard to undo.
Much harder to undo. And actually, that's been one of the downfalls of NHS services. So the service that those children should access is called CAMS, Child and Adolescent Mental Health Services. But really, over the last 20 to 30 years, maybe even longer, the very expensive, highly qualified professionals within those services have very slowly been replaced. So, clinical psychologists are an expensive resource for the NHS. So, they have looked to find cheaper alternatives. And so, clinical psychologists have slowly been replaced by mental health therapists and CBT therapists and psychological practitioners, all of whom are very qualified in their job, but not to the same extent as clinical psychologists. So that in itself is fine. But now when you look into the fact that waiting lists for NHS services are getting longer and longer, um, all across the country, those services have to make a decision of who gets to the top of those lists, who gets that service. And quite understandably, they then say the children with the most severe needs, the children who are most risky, as they would possibly call it, which means those children get to the front of the list, but now they're being seen by mental health professionals who are not as qualified as they potentially could be because of that change over the years. So actually, now when you get to the front of that queue, the support that you might get even then might not necessarily be the best that it possibly can be. And that's a real problem within the NHS services.